Welcome everyone. This is Patricia from the International Hospital Federation. I hope you're all safe and well, and thank you very much for joining us today. We at the IHF are hosting this COVID-19 webinar and live Q&A series to share experiences, good practices, insights, and recommendations from our members and other organizations across the globe. This series has been created with healthcare providers for healthcare providers, including decision makers and those involved in managing COVID-19. We hope the lessons you take away from this webinar will help you in facing the crisis and beyond. I would now like to introduce the moderator of this webinar, IHF CEO, Eric de Rudenbeck. Eric?
Yes, thank you very much, Patricia, and welcome to today's webinars that will take us to India. I'm sure that you have seen some of the pictures from India when this country has implemented a massive lockdown to face the COVID. And to date, I believe this approach has seemed to pay off, because if we look at the number of cases that they are still very marginal in regard to the huge population of this country and the very high density in urban areas. And I guess that you also are aware that in India, the private sector is playing a prominent role in the hospital services, with a number of major private hospital groups. Among these groups, one of them is quite well known worldwide, and this is the Apollo group that we'll hear from today. For IHF, it's important to share how the hospital sector has responded to COVID, and we believe that both public and private sector have together an important role to play. With the experience of the Apollo group, we will have a chance not only to uncover, how hospitals from this group has prepared and participated to the COVID response, but also what has been the role of private hospital sector that doesn't rely, like the public sector, mostly on the public funding, and doesn't have the same public-related obligations to put in place a response. So we will understand how private hospitals are also deeply rooted in the community and have and activate in occasions like a pandemic, their corporate social responsibility, both for their employees and the community they serve. And their role that also goes beyond just providing healthcare, their role also as part of the global research community. It's really a great pleasure for me to introduce you the speakers of today's, Professor Anupam Sibal, who is the Group Medical Director of Hospital Apollo. He has been in this position since September 2005, and he has many other affiliations. He is the President of the Global Association of Physicians of Indian origin since this January. So it's another important responsibility, Professor Sibal, that is on your shoulders. You are a member of the Regional Middle East International Advisory Board of the Joint Commission International. You are a member of the Institute body, and you have a lot of achievement. You have helped to put in place a successful pediatric liver transplant program in India since 1998 in the Apollo hospitals. And by the way, the Apollo transplant program is the most important transplant program in the world. I think, when we talk about India, there's nothing small. Everything is always big, and but this is really a major achievement, with more than 1,200 transplants performed every year. But in addition to these clinical activities, you have authored hundreds of publications. You have given more than 200 national lectures, over 130 international lectures, and we are always a pleasure to hear you in these lectures, and including in the World Hospital Congress that IHF is hosting. And you are authored textbooks on pediatric gastroenterology, and the national bestseller that is called "Is Your Child Ready to Face the World?" Now you are going to tell us how we are facing the COVID situation, which is a worldwide challenge for all of us. Professor Sibal, I really am eager to listen your presentations and your experience. The floor is yours. You are muted.
Yes, I'm unmuted. Thank you very much, Eric. It's always a privilege to interact with you and the IHF team. Thank you, Patricia, for making this possible. And I'm absolutely delighted to be interacting with colleagues from across the globe. What I'm going to do is basically talk a little about India as a country, what we've been doing with COVID, and then move on to a little bit about what the Apollo group does, and then get into COVID. Am I loud and clear? And can you see the first slide?
Yes, Professor Sibal.
Okay, great. Thank you so much. So just to give you a sense of how large India is, we have 1.36 billion Indians, 17.7% of the world population. Canada, United States, Argentina, the entire EU, the Russian Federation, Japan, Australia, South Africa, Tunisia, Kenya, Chad, Niger. You put them all together and that's equivalent to India. We have citizens that believe in 9 religions. We have 22 official languages and 1,652 dialects. In the last general election last year, 603 million Indians voted. And I mentioned this, and it's important to realize the vibrancy of the Indian democracy because every decision is debated. India is on the move. So if we look back at 1991, of course, there was no internet. There were just about 5 million telephone users. We had 1 television channel, which was nationalized. We had 1 airline. We had 6 million foreign exchange dollars in $6 billion in foreign exchange reserves. Turn to 2020, 687 million internet users. And again, this is very relevant because a lot of what has been done with COVID has been achieved by using the internet. We have 1.2 billion phones, 872 television channels. And again, this is very relevant when it comes to information dissemination. 26 airlines, and in terms of foreign exchange reserves, $485 billion. And India is the 3rd largest economy in terms of purchasing power parity. And again, this becomes relevant as we talk about COVID. Many of us have seen this film, Gravity. Fantastic film, cost $100 million to make. In contrast, the Indian Mars mission, the Mars Orbiter mission, which was the first global mission to be successful in its maiden attempt to enter the orbit of Mars, cost only $74 million. And the reason why I mention this is because we understand frugal innovation. And again, frugal innovation is going to be very relevant as we define the new normal. India has 28 states, 9 union territories, and the administrative headquarters are district, and we have 739 districts. This is important because health is a state subject. So each state has the flexibility to decide on how they're going to enact different laws pertaining to health. The union territories, the laws are made by the center, and the central government gives out recommendations and guidelines, but it's really up to each state to decide how they want to implement policies and how they want to manage health services. Each of the 739 districts has an administrative head, and he or she, as the senior most civil servant in that district, is responsible for delivery of care and other services at the level of the district. And the size of districts vary, the population of the districts vary considerably across the country. Now, turning to COVID, the first case was diagnosed on 30th January 2020 when a student returned from Wuhan to Kerala. Kerala is a state in the south of India, also known as God's own country, very popular with travelers, also has the best healthcare indices in the country. It has 100% literacy. So when this first case was diagnosed, a comprehensive response system was put in place well before the WHO declared coronavirus as a public health emergency. patients started to be screened across 30 airports, all major ports, minor ports, land borders. Evacuations of Indians from Wuhan and other areas, other parts of the world like Iran, where there were a significant amount of COVID at that point in time, was executed. All these individuals were brought back by special planes and put into quarantine centers. The government enhanced the quarantine facilities. Testing, which was available in just one lab, National Institute of Virology, was expanded considerably. And over a 4-week period, the number of labs across the country grew. Efforts were made to enhance the infrastructure in terms of managing the pandemic, getting isolation facilities, ICUs, getting PPEs. And as Eric mentioned, private healthcare plays a very significant role in India. Up to 70% of healthcare in India is through the private sector. So the government started engaging with the private sector very actively with the idea to get a public-private unified response towards dealing with this COVID pandemic. So if we see here that from the first case being diagnosed on 30th of January, for the first 1 month, we were really at about 3 cases. So there wasn't really any further import of cases into India. And then come March, after about 30 days, we started to see an increase. And as we went through March, you can see that the number of cases steadily increased. So from 1 case to 560th case, we took 55 days. And when we crossed 560 days, an unprecedented decision was made, a decision that no country, no state, in fact, no district or no region anywhere in the world had done, which was a complete lockdown with just 560 cases. And what did this lockdown mean? This lockdown was a very strict lockdown. People could not step out of their homes, but they could go and get their groceries. Banks, hospitals, pharmacies were open. Everything else was shut down. So you couldn't really go out for a walk. 2 people couldn't go out and actually just have a chat outside their home. So there was a complete lockdown and everyone was supposed to live inside their home. All commercial and private establishments were shut down. Only work from home was allowed. All educational institutes, schools, college, universities, training, research institutions were shut down. All places of worship were shut down. And that's very important because religion plays a very important role in India, in our day-to-day lives. All public and private transport was shut down. No Ubers, no taxis, no metros, no buses. All domestic and international airline operations were shut down. And of course, it was not allowed to have any social, political, sports, entertainment, academic, cultural, or religious activities. So as you can see, this is a very comprehensive lockdown. So what was the result of this lockdown? So in 21 days, India went from 560 to 1,363. So now if you compare this with other countries, the United States in 21 days, and I'm looking at 560 as the baseline, went from 560 to 162,000, United Kingdom 560 to 34,000, Italy to 41,000, Spain to 73,000, and France to 33,000, and India from 560 to 10,000. So if there wasn't a lockdown, we don't know what the figures would have been, but the estimates is that we would definitely have been 10 times more than what we ended when the 21 days of lockdown, the first lockdown, came to an end. The government of India developed Arogya Setu. This is an app, and I think this is the most downloaded health app in the world. It gives you all the information that you need about COVID, all the resources, where can testing be done, what are the guidelines. It also has a tracker wherein it can tell you if you've come in contact with anyone who's COVID positive based on the database and using technology that all smartphones have. And this was a very forward-looking step, and this was initiated a very long time ago. To encourage, to increase the morale of healthcare workers, the police, and everyone else who was providing emergency and essential services, Indians came out of their homes, but they could just come out onto their balcony or onto their gate or to the garden and they clapped. There were bells, all kinds of musical instruments were used just to create that sense of everyone coming together to support all those who were frontline in managing COVID. What was the impact? From a doubling rate of 3 days prior to the lockdown, we achieved a doubling rate of 8 days. So pretty significant. And in fact, WHO praised the response, describing it as timely, comprehensive, and robust. Because the numbers were increasing, the government decided to extend the lockdown for another 3 weeks. And this was lockdown 2. And from about 10,000 cases that we had, there was a steady increase to about 40,000, 39,980. So the lockdown did again show significant gains because the doubling time went on reducing. Again, to mobilize the community towards this common enemy, there was, at again the request of the Prime Minister, a ceremony that was conducted on a Sunday, wherein candles and lights, and in India we refer to as diya, as a symbol of removing darkness that was being spread by the coronavirus. And again, this brought the country together. A phase 3 of the lockdown was then initiated for 14 days, and it was not as rigid as the first and the second lockdowns. And the idea really was to allow some economic activity, some movement, some flexibility in districts and in states where the number of cases had not risen. And you notice here that cases gone up from 40,000 to 90,000. And then came phase 4, which will end on 31st May, another 14-day period. And again, you see that our cases have gone up from 96,000 to 131,000 till yesterday. Now, something which is very important that we need to look at when we compare on India's response with other countries. So we, in the days that we've been on the lockdown, have gone from 560 cases to 138,000 cases. So now let's see how other countries did when we compare their journey from 560 to 138,000. So India took 62 days, United States 20, Spain 30, Italy 41, France 40, UK 42, and Germany 42. So clearly India did very well in that we managed to slow the transmission through these lockdowns. And this is pretty solid evidence to support the employment of lockdown as a strategy. What were the major gains? Now cases now are growing at about 5%, and that's for the last 5 days. Doubling is now 13 days. And I just want to remind everyone that we were doubling at 3 days. What has been very significant is that the Indian industry has come together, and from virtually not manufacturing any PPEs, we now manufacture 450,000 PPE suits a day out of 600 lab certified companies, and we are the world's second largest manufacturer of PPEs, and this has happened in 2 months. The government has been very proactive, the federal government, also the state governments, the Indian Council of Medical Research, the Health Ministry, and several other governmental agencies. So we've had 110 advisories. There have been 60 advisories for hospitals, 35 on travel, 23 for citizens at large, 19 on training, 14 for employees. So lots of advisories and updates. Turning now to Apollo Hospitals. Apollo Hospitals Group is the largest corporate healthcare group in the country. Started in 1983 with one corporate hospital in Chennai, which was called Madras, a 150-bedded hospital. After that, there's been rapid growth, tertiary care, secondary care, primary care, pharmacies, telemedicine, education, research, project consultancy, diagnostics, wellness. And so now we have 73 hospitals, close to 10,000 beds, and 90 clinics that are spread across 16 states. And I want to highlight 16 states because this means that we have to constantly adapt to the rules that are relevant for each state, and we have to work very closely with each state government. So we launched Project Kavach. Kavach means a shield in Hindi. Let me walk you through what we have done as part of this project. So one of the key pillars was information dissemination and creating awareness. We needed to be accessible 24/7, whether it was in terms of reaching out to patients or if it was to meet the information needs of the community at large. Our pharmacies, which are open 24/7, had to have everything available and deliver it at home. We developed a COVID scan that allows an individual to do a self-risk assessment on whether the symptoms that an individual has are related to COVID or not. We needed to develop testing facilities. We established fever clinics where we could screen individuals. We also developed quarantine facilities in hotels. And then, of course, we had to be ready to manage treatment and treatment for patients with mild symptoms, moderate symptoms, ICUs, to have the entire gamut of services available depending on the clinical needs of the patients. So let me just give you some examples. So these, as you can see, are some of our facilities. We needed to make sure that we had state-of-the-art PPEs. We had to make sure that the entire facilities, every step, every single process, every system had to be relooked at to make sure that we are ready to take on COVID, because COVID is not just any bug. It is quite a tricky bug to contain. And so we really decided to revisit everything. Across the group, we decided to create 1,000 negative pressure isolation beds. We created specialized and dedicated teams, each team looking after their area of responsibility for infection control, for diagnostics, treatment protocols for adults, treatment protocols for newborns, for pediatrics, a clinical trials group, a group that was charged with looking at plasma therapy, newer therapy. Based on the advisory that the government issued, we gave the option to all our employees whether they wanted to go into a program for hydrochloroquine prophylaxis with ECG monitoring, and a significant proportion of the staff decided to go into this. And we know that there have been some very interesting papers that have come in favor of hydrochloroquine, and of course in recent times against the use of hydrochloroquine in treatment. We also created the Red Book to manage COVID. We revise this Red Book every week. In fact, the 7th version has just come out today. It's a 175-page book that has every single protocol, every single process that someone needs to be familiar with to manage COVID. So how to move patients in outpatients, how to do lab testing, how to collect samples, how to dispose of waste, how to do their daily assessments, how to manage the OR, how to manage the ICUs, how to manage the discharge process. We became the first private sector labs in a hospital setting to be given permission by the Indian Council for Medical Research for RT-PCR testing. We established fever clinics. We also established drive-through testing facilities because some people, and understandably, did not want to enter a lab or a hospital for testing. In terms of trials, we worked very closely with the WHO, other agencies, and the pharmaceutical industries. We're part of the Solidarity trial initiated by WHO. Our flagship hospital in Chennai is part of it. And as we know that retrovirals and remdesivir are treatment arms. To manage the cytokine storm, we have initiated a trial on an IL-6 antagonist, and this is happening at 3 centers, a recombinant BCG trial that's happening at 3 centers, a convalescent plasma that is happening at 6 centers. There are some other trials that we are working with the industry on, favipiravir, which is a Japanese molecule, nifamostat, which is again a Japanese molecule, and an Indian phytopharmaceutical agent. Considering the problems with distance and lack of travel, we decided to enhance the eICU service to help smaller hospitals in the periphery get expert advice. We have a eICU platform that we expanded so our intensivists could not only monitor patients across different hospitals, but also give advice and interact with colleagues that did not have that expertise. and felt the need to speak with a specialist. We developed the Apollo 24/7 platform. And what this platform does is it allows online consultations. There is an app, and we've now done 27,000 consultations. We're doing more than 1,000 consultations every day. The patient can choose their doctor anywhere in the country based on specialization and super specialization and their credentials. Everything is easily transmitted, and the patient gets an e-prescription and a copy of his or her records as the consultation ends. We also started a facility for online booking of medicines and diagnostics, including home collection of samples, delivering medicines at the doorstep through Apollo Pharmacy, our network of the largest network of pharmacies in the country, 3,500. Apollo Diagnostics enhanced their ability to do home collection. And I think the idea really was to be available to the patients at their doorstep. To enhance knowledge of physicians and surgeons and all healthcare professionals, nurses, we decided to start a certificate course in clinical management, and this was through Medvasti, which is our internet-based learning platform, and 8,000 people earned their certificate within 24 hours of us announcing this program. Ventilation training we thought was very important, so in collaboration with our faculty at Apollo and the Indian Society for Critical Care Medicine, integrating a highly advanced ventilator simulation program from Boston Children's Hospital, we started ventilation training, and we've been doing this effectively for different types of healthcare professionals across the country. We made sure that we use social media effectively, and we had clinicians do a lot of webinars, to use virtually every model or every mode of social media, from Zoom to Microsoft to Facebook to WebEx to YouTube, to reach out to the community. And while all this was happening, we also continue to provide high-end tertiary care. And I want to give the example of little baby Noor. Baby Noor landed in India from Malaysia, and the day she landed, there was guidelines that were issued by the government of quarantine from all patients or all individuals who've flown in from Southeast Asia. So the baby went into quarantine for 2 weeks. This child had biliary atresia, where there is jaundice from birth, and had worsening jaundice, had a lot of fluid in the belly, had pronounced liver failure, had been on a ventilator in Malaysia before transfer, came in, also had a complex congenital condition in that with heterotaxy, the heart was in the center of the chest, so was the liver. This child developed bradycardia while waiting for a transplant. We had to put in a pacemaker, then we tested for COVID, and the mother was the donor, and after both the donor and the baby were COVID negative, this child underwent a successful liver transplant, got discharged in 3 weeks, and there was a special plane leaving for Kuala Lumpur last week, and you can see her happy, and she's back in Malaysia. The coronavirus risk scan that I talked about, we have now had 15 million people who've done this self-assessment, and this has become really popular, and this continues to be downloaded frequently. So we tied up with hotels across the country and developed a program called Stay I, which is really about isolation. So we developed clinical protocols that we shared with the hotels. There was 24/7 clinical monitoring for individuals who'd gone into quarantine. At the door of the room that these individuals were in, medicines were delivered, samples could be taken, because many of these individuals had other medical needs, diabetes, renal dysfunction, heart problems that needed some sampling. And of course, all the food was delivered in contactless, tamper-proof packaging. We also started a 24/7 COVID helpline and to give information to individuals about COVID. We felt, and I mentioned to you, we have 627 million Indians on the internet and 1.2 billion phones. So we use social media very effectively. And as of this morning, we've had 80 million people that we have touched through different social media platforms to educate them, empower them, and answer a lot of their questions. We also launched the Global Indian Physicians COVID-19 Collaborative. There are 1.4 million doctors of Indian origin in the world. We have members from 45 countries. So we brought the Global Association of Physicians of Indian origin, which is the platform that brings doctors from across the globe onto one platform. We have the American Association of Physicians of Indian origin, the British, the Canadian, and everybody came together to exchange ideas, to deliberate and to develop the best way of handling COVID. So we launched this with the president of all societies, and considering the stress that healthcare professionals are going through, we had a spirituality session. We then went on to look at diagnostics. Last week we had a pediatric session. We have another session on treatment and then one on women's health, and we will continue to do several of these programs. The community in India has really come together to support doctors, acknowledge their work, and in addition to the celebration that I talked about with the clapping, we also had the candle event, but we also had the Indian Air Force and the Indian Navy shower petals on different hospitals. And this is our hospital in Delhi, and you can see the Indian Air Force plane over our hospital. And we, as healthcare professionals, as a gesture to acknowledge the recognition, offered our salute to our soldiers who ensure that we sleep safely at home. And in fact, this video became viral as well and was recognized across the country. What COVID has done when it comes to Indian healthcare professionals, the private sector, is that we firmly believe that we can, we must, and we will conquer COVID-19. I think I'm going to stop here now and be very happy to take any questions that you might have.
Thank you so much, Professor Sibal. It's always a pleasure to hear you. Very clear and comprehensive presentation. And I will start with questions that the presentation is triggering, because as you mentioned at the beginning, you know, India is so big country, so diverse country. How did you achieve to put in place in a group like yours that is covering the whole country, all this program? Was it something that you organized, you know, in a top-down way, where you had, you know, a command and control center that has put all that together and disseminate very easily? Or did you created working groups that brought up very quickly solutions, and you had a way to make sure that it was adopted and deployed very quickly? How did it work? Because I believe this is really impressive experience when we see the list of the achievements, but it's really raising the question. It's beautiful what you have done, but how did you do it?
Thank you, Eric. And that's a question that's quite often asked. So let me explain to you our culture at Apollo. So over the years, we've had many initiatives, and the approach always has been that we put together working groups. We start off with a pilot with say 3 hospitals, then we take it to 8 of our large hospitals, and then we take it to another 20, and then eventually to across the group. We've done that with our outcome measures called Apollo Clinical Excellence, ACE, where we look at outcome measures for 25 important procedures every month. We get a report that goes to the board. We have an audit system that's been working very well over the years. We also have the Apollo standards for clinical care that we've established over the years. So the culture is collaborative. The culture is about groups of people coming together, sending the recommendations then going up to the senior team, to the top leadership, quickly going down, and then being open to see how things work on the ground, and teams then feedback saying, hey, this is working, this is not working, this needs to be tweaked. So we've had this culture here for years. We had that when we were dealing with swine flu in the past, when we were dealing with SARS. So for us, it was something that we've done in the past. Of course, the quantum of what we've had to do this time is at a much larger scale. Also, the speed at which we've done this was unprecedented, because we just didn't have the time, but the culture remained the same. So we had working groups on plasma, on medication, on testing, on labs, on infection control, on essential services, on what is it that we need to do in terms of slowly getting other services on board. So we had groups across, just to give you an example, the clinical management protocol is made by 19 top pulmonologists, intensivists, and infection control doctors. They review everything that's available. And you know that there are about 80 papers on COVID-19 that are published on PubMed every day. So on every 7th day, they come out with their recommendations. And we then transmit this to all our hospitals, to all the leadership teams in all the hospitals, and to all the clinicians who are looking after patients. So that's how we were able to do it. The speed was fast, it was swift. The decision-making process was rapid. We tried to cut down on the bureaucracy to virtually zero. And of course, technology was at hand. We have groups. We have a lot of exchange of ideas on WhatsApp. We do regular meetings with teams across the group. And if anyone has any issues that they believe are relevant, or they've learned something that has an impact, or they believe will have an impact on others, they will post this, and we will, with an open mind, look at it at the corporate team. So I think technology has come to our rescue, and the fact that you are sitting in Switzerland and we have colleagues from different parts of the world connecting seamlessly, and we can make a PowerPoint presentation without any glitches. So we've used technology very effectively, and I think that's what's worked well for us. But at the end of the day, it's been a culture of collaboration. It's a culture of coming together. It's a culture of learning from each other.
Yeah, that's very interesting, because from some experiences, we had the feeling that, the capacity to be very responsive was because the facilities, the organization were well prepared to face outbreak, while you are demonstrating that when you have an embedded culture of collaboration and of mainstreaming innovation, adoption of innovation, then you can face, I would say, almost any kind of unexpected situation in a very effective way.
Yes, thank you.
So the Apollo Group is, as we said at the beginning, at the introduction, one of the leading private hospital groups within India. So you have explained what you have done. How did the other private institutions responded, and how did the public hospital responded? And did you work together, or each of you did your own activities?
So what has happened is that, as I mentioned, the government very clearly recognized the fact that when 70% of healthcare in India is delivered by the private sector, whether it's diagnostics or treatment, the public sector alone could not manage. So there was an open dialogue that was initiated, and the public and the private sectors came together. We also have lots of working groups where we have ministry officials, the Indian Council of Medical Research head, and the private sector CEOs, medical directors, the government sector, public sector CEOs, medical directors coming together, exchange of ideas. And so many of the changes, and as you know, policies have changed, testing criteria have changed, new kits become available all the time. So through this dialogue that has happened, the private sector has been able to voice their ideas, their concerns to the governmental authorities, and several policy changes have recognized the points that have been raised by the private sector. So no, that's at the level of policies. The private sector also have their own working groups where there's been a healthy exchange of ideas, and suggestions have come from one hospital that have been incorporated by other hospitals in the group, and we have collaborated with other hospital groups. We've also collaborated with the public sector saying, hey, listen, what is your experience with this? Do you think this is working? What do you suggest? So there's been a lot of dialogue. And I think one thing that COVID-19 has taught each one of us is that there are many unanswered questions. And if we think that one entity, one group, one hospital chain will have all the answers, that's not happening. And we are seeing this repeatedly with the data that is emerging, whether it's in clinical trials or in diagnostics, that we need to collaborate and we need to learn from each other. And I think COVID-19 has helped break a lot of these silos that we have conventionally worked in, and a lot of barriers have been broken.
So yeah, thank you. And I think that's also a very important lesson for the sector, to make sure that we work better together, and we really need to build on that. There is worldwide also a lot of questions are around, supporting the staff that has been under a lot of stress and pressure. What have you done specifically in Apollo Group and also more perhaps in other groups in India to make sure that you could help the health workers to manage the stress with the COVID and the extra pressure of work, but also potentially the fear with this new communicable disease that is still quite unknown in terms of how it is, even if it's a coronavirus.
So I think it's been at multiple levels. So at the highest level in the country, the Prime Minister making two attempts and very successful attempts as requesting the community at large to recognize the contribution of the healthcare professionals. And that has gone down really well. The Indian, security agencies reaching out to the community. So at the national level, at the highest level, 3 of these initiatives have really helped boost up the morale of the healthcare community. So that's at one level. At the level of state governments, we've also seen that. Coming to individual groups, so like at Apollo, the first thing is that, you also have to encourage in every healthcare worker, whether it's the junior most nurse who started her career a few months ago to the senior most person, must feel that they have the opportunity to speak up. So I think that's a culture that we've had and that's a culture that we encourage. So everyone's had the opportunity to come up and saying, I have this idea, or do you want to consider this? Or this is my problem. Or, why don't we look at things this way? So the speak up culture has been very well embedded in our system. And I think that's helped. The second, of course, has been providing support when people have been stressed. So we've had lots of counseling sessions. We've had psychologists, we've had psychiatrists come in. I mentioned to you the session that we did with a spiritual leader. We've had several of these. We plan more of these. Spirituality plays a very important role in India. And I think that's something that we recognize, and that's something that we have encouraged to use and to remind everyone that there is a higher purpose for which they're coming to work well beyond the call of duty. We've also had events like we had the Nursing Day, Florence Nightingale's birthday, the 200th anniversary, a birth anniversary. So we had a big celebration. Of course, it was all virtual. We've, once the 14-day period of nurses and staff completing their COVID duties, and then they get a break. So we celebrate that. When they come back, we celebrate that. So there are little things, there are big things, but all put together, every little thing going on to, the groups that we have for nurses and other healthcare professionals, a recognition of the work that they're doing. I think that goes a long way. So there have been several talks, several sessions that the senior leadership, top leaderships organized, and I think that helps significantly in this endeavor.
Yeah, thank you. So if we move from the health workers and what has been done with the health worker to the patients, the fact that you are a private health provider, does it mean that there has been differences in the populations that are, using the Apollo group or the one you are targeting? And does it bring different challenges in the provision of care, the difference in socioeconomic status of or community belonging, or as we know in India, you have these groups, the castes. So how did it work through COVID? Did it break the silos here also?
So what happens in healthcare in India is that for anyone to access private healthcare, they have to have either some kind of an insurance, and there is an insurance scheme that the government started, which is the largest healthcare insurance scheme in the world, called Ayushman Bharat, that gives access to the private sector. There are state government schemes, there are employee schemes, there are individual insurance programs, and there are certain individuals who pay for their own care out of their pocket. So private healthcare obviously will require some amount of billing, and that billing means that there has to be a financial reimbursement model. And that holds true for liver transplants or for bypass surgery, and that holds true for COVID. The government decided that they would have private sector facilities where obviously the frills are more and people want a greater degree of comfort. They want isolation facilities that are single. They want access to television and internet and so on and so forth. And on the government side, it's very hard to provide that. Those kind of frills really on a very wide scale. So patients have the option. Those who want to go to the private sector, go to the private sector. Those who believe that they would be better off in terms of going to a government facility because they don't have access to funding. And that's really the mechanism that has been in place, and that applies to COVID as well. So there are really no real challenges in terms of social that you mentioned in terms of barriers to access to care. The financial barriers have remained, but the government has made a lot of effort in terms of breaking these barriers through that Ayushman Bharat scheme that started, and that now it's the fact that it has been in existence for about 18 months has really turned out to be a boon.
So you have presented with the response more or less, I mean, more than less, the way you have covered 4 phases in the way to approach the COVID. What is the next phase for India and for Apollo Group, whether it's going to go to the phase 5, and where are your current perspective for the next move?
So will we wait to hear from the government in the next 4 or 5 days on what their plans are? But clearly, the lockdowns have been very extensive, and a long-term lockdown is not sustainable for the economy. People have to come back to work. They have to get on with their livelihood and get back to some kind of normalcy. So we believe the future, or what is the new normal, is going to be social distancing is here to stay. People will have to wear masks. We will have to insist, and people are doing that already in terms of hand washing. We already have done elective surgeries, elective outpatient procedures, consultations other than the video consults that I mentioned. Physical consults have started. I think we're going to see more and more of those happening, but of course with adequate precautions. So it's a question of coming together to identify the new normal in healthcare and to prepare for that. And that means a normalization of all essential services, some so-called elective procedures where the patient, for example, has had problems with a particular system, body system not working, and they want that fixed. And there is no reason that we can now postpone that beyond a particular, time frame. It's already happened that people have had to wait for several weeks. So it's a question of restarting services with adequate precautions, making sure that our staff thinks of COVID all the time and takes all the precautions that we need to keep our hospitals COVID safe, make sure that our patients don't get COVID while they're in hospital, make sure our healthcare workers are well trained, understand all the processes, and take every precaution that they need to.
So while you are thinking and preparing for the new normal, what can you already say about, what has been put in place in terms of management practices, leadership competencies that have appeared during the way you have organized the response to the crisis? Are there any of them that can be sustained and that can help in advancing the performance of leadership and management in the group?
I think it's been a great reinforcement of the collaborative culture that we are so proud of at Apollo. The fact that ordinary men and women, when faced with extraordinary circumstances, perform extraordinarily well if given the right environment, the right encouragement and recognition. So I think it has reinforced again what all of us as healthcare professionals and leaders know, is that recognition, the understanding that what each individual does every day is special. What we do every day is God's own work. What we do every day, only few people have the opportunity to do. And when pushed, we can all come together and as a team break barriers, take on challenges that we alone thought were unsurmountable.
Yeah, so another point you mentioned when we were talking about the responses that and the differences between the potential population that is going to this kind of facility or to other facilities according to their coverage and health insurance. From a broader perspective of financing, you definitely had to spend more money to be able to put in place all these responses to COVID. And on the other side, even though you maintained some activities, you had to let down a number of activities. So are you going to face, do you believe, a major financial crisis? And does the government has provisions to help all the private sector to come over this gap in financing these services? Because I guess you didn't lay out the staff, you kept your staff. So and we know that, you know, a large part of the cost is almost fixed cost in the hospital, if you consider that the staff is a fixed cost, because you don't just move it like that out and in. So how are you going to face the financial sustainability in the coming months?
As you rightfully explained, Eric, that you know, the fixed costs are huge, the HR costs are huge in healthcare, and these are costs that we can do nothing about. And clearly, the financial health of every healthcare institution, government or private, is under a lot of stress. We've looked at ways and means of how is it that we can manage costs a bit better without, of course, having an impact on the frontline workers and their salaries. We have made submissions to the government in terms of some amount of financial help, and the government has developed a very elaborate financial help program for different industries, and we hope that healthcare will also receive the attention that we believe it deserves in terms of a financial rescue package.
Yeah, so hopefully that will be there at the level that you need and you expect, because definitely for health service provision, if we don't have the right support for the government, the population is going to be in trouble, because we need also to catch up for all what was not delivered during this period.
Yeah.
Talking about collaboration, you mentioned also that you mobilized hotels to take care of mild patients or for isolation. How did you work with them? Did you train the staff, or did you send your staff? What was the deal? And do you have, if I want to expand this question, did you organize specific deals with the corporate sector when you, for example, mentioned that from almost no protective equipment produced in India, you are in 2 months, the industry was able to produce massively? Is that a part of collaboration with the hospitals? So how much the hospital have collaborated with other part of the industries and to find the responses?
So to answer your first question about hotels, yes, we work very closely with them, gave them guidelines, did their training, some physical, some virtual, and access to all the protocols to make sure that there's compliance, because they have expertise in running hotels, but not in terms of sterilization and in terms of the kind of things that we need to make sure when we have someone with a potentially infective condition. So it's been an exciting journey for us. In terms of personal protective equipment, we worked with the experts within our teams, worked with experts in the textile ministry, and they worked with manufacturers, garment manufacturers on this. These are what the specs are for PPEs. The government had certifying labs come up pretty quickly with their standards. So it's been really a collaborative effort, and it's not just been about PPEs, it's about manufacturing of ventilators and so on and so forth. So I think it's been really work that brought together different sectors, different industries, private, public, all coming together with, hey, we have to do this for our country. We really need to augment capacity, and we need to do this really quickly.
Yes, so we could have many other questions on your very interesting presentation. Let me give some takeaway messages, because we are coming to an end with our presentation. And I'll let you the floor for concluding remarks. So first, I really think that one of the lessons really from the experience is around what you mentioned in your slide, frugal innovation, and the way to put it together is a great combination between the best use of the technology and the social mobilization. I think that's something that this combination is very important and unique. You may have it through the COVID app, but the fact that at the same time that you are mobilizing sophisticated technology and making sure, you know, that the spiritual needs of the people are also fulfilled and that people are showing their concern, and that that's a really an important combination, and it's really important for the success. The other thing is definitely, and you underscore it several times, is that to be very quick in your response while comprehensive. The fact of having an embedded collaborative culture and also a tradition to adopt quite quickly innovation and mainstream the innovation is really a major asset, and that will take you certainly a long way facing potentially any other kind of crisis. The other element is around collaboration and I would say support. And I thought that the example of the EICU was quite an interesting example of how the stronger must help those who don't have the same assets. So while the hospitals are serving the population, they are also helping each other so that they all together can serve better the population. At the same time, while facing the crisis, which usually is emergency mode, and you try really to respond to the most important priority, it's important not to put aside the need for capacity building of the staff. And the way you have done it in the training, systematic training and specific training, is showing that definitely a crisis cannot allow to put aside the need to build capacity on site and immediately if you really want to sustain and face the crisis. And the crisis, of course, doesn't mean that although you need to focus on it and develop activity, you need to shut down all the rest. We have to serve the health of the population, and the story that you gave about this Malaysian little girl is a good example of how we have not to forget that our mission in the health sector is to serve everybody, but is also to work on the future and to be involved in the clinical trials. So the research is also one of important missions that, of course, a crisis should not let us let down. So I think these are a number of messages that I can share from your presentation. Professor Sibal, any other concluding remarks, and we'll come to an end to this webinar.
Eric, thank you very much. I think you summarized it beautifully, and it was lovely interacting with colleagues from across the globe. Thank you for a fantastic session, and thank you for those questions.
Thank you very much. And Patricia, the floor is yours for presenting the next steps on the webinars.
Thank you, Eric, and thank you, Professor Sibal, for the very comprehensive and insightful presentation. To everyone, just a reminder that we will be publishing the recording of this webinar a few days after the session. We will notify you by email once it is available. We hope you can still join our next webinars. We have a few more scheduled in the next few weeks. The schedule is now on your screen. And you can register by going to www.ihf-fih.org/webinars. On Thursday, we will have the CEO and CMO of Aga Khan University Hospital, who will share how they responded and adjusted clinical services during the crisis and how they're planning to move towards resumption of normal clinical function. Hear how they created a task force which developed protocols to combat the pandemic, collaborated with local and regional health authorities, and established a 100-bed COVID hospital. So we hope to see you there. In the meantime, please stay safe and healthy. Together we will overcome this crisis. Thank you again for joining us today. And Professor Sibal, thank you so much for your time and for your contribution in this COVID webinar series.
Thank you very much, Professor Sibal, and it's really always a pleasure to work with you and look forward for our next opportunity soon.
Thank you very much.
Thank you, everyone. Have a great day. Bye.